What racism looks like. Meet Emily and Kaylani. Emily and Kaylani face challenges due to family dynamics, communities, and organizations they interact with frequently. Unfortunately, systemic, structural, institutional, and individual racism has played a role in shaping their experiences. While Emily has benefited from numerous opportunities and privileges, Kaylani has faced significant disadvantages. Systemic racism. Kaylani and Emily earn similar incomes and manage their finances efficiently. Both women are college educated and experimented with drugs while in college. Kaylani rents a house a few blocks from where she grew up, whereas Emily's parents live in the suburbs with a 2-bedroom apartment above their garage. Emily stays in the apartment for a small rent, and her parents are excited to help care for the baby. Kaylani's mother owns her small 2-bedroom home in a neighborhood historically created by segregation laws. Kaylani wanted to move to a different area, but found that the rent was much higher, and it could be difficult for her mother to help with the baby if she lived further away. Structural racism. Both Emily and Kaylani researched an OBGYN who would accept their insurance, provide a holistic delivery experience, and deliver at a hospital close to their home. Emily chose her healthcare provider from a long list at a new women's hospital in her neighborhood, while Kaylani only had a short list. The hospital near her home has not been updated in 60 years. It was constantly under investigation for quality issues. Institutional racism. Emily and Kaylani's OBGYN offices have a policy that you will be fired from the practice after missing 4 prenatal visits. When Emily goes for a prenatal visit, she typically can do it over her lunch break. She is usually there and back at work in about an hour. Kaylani must wait a few hours to be seen, as there aren't enough providers. Kaylani has been reprimanded at work for missing time. Her boss understands and agrees to give her the time off, but it would be unpaid if it is longer than her lunch break. Kaylani can't afford to have her paycheck be less and must use public transit to get to and from her appointments. She leaves before being seen to get back to work because of the long wait time. The OBGYN's office sent her a letter informing her she is no longer a patient at 36 weeks because she has missed too many appointments. State community racism. Kaylani begins to research other options for continuing her prenatal care. She is unable to get into any other clinic in her community before presenting to the hospital in labor due to her insurance limitations. Though Kaylani lives in an urban area, her community has an extreme shortage of OBGYNs. Emily continues to have regular prenatal visits using her vehicle during flexible work hours. Individual racism. Kaylani presents to the hospital in labor, complaining of severe pain. The nurse assumes she is a drug user and obtains an order for a drug screen. Kaylani is in early labor and is requesting medication for a pain level of 8 on a 1 to 10 pain scale. The nurse assumes her pain can't be that bad and that Kaylani is just drug seeking. The nurse continues to ignore her complaints of severe pain and is fixated on the pending lab results. Kaylani has an abruption of her placenta and is rushed to the operating room. Kaylani proceeded to have significant bleeding, required a blood transfusion, and her newborn was admitted to the NICU. The drug screen was negative. Across town, Emily presents to the hospital in labor, complaining of severe pain. She was quickly evaluated, pain medication provided, and it was determined she was abrupting. She is taken to the OR before significant blood loss. Both Emily and the newborn are stable after delivery. However, at 24 hours postpartum, Emily's newborn is jittery, continuously crying, not feeding well, running a fever, and vomiting, symptoms of neonatal abstinence syndrome. Her newborn is admitted to the NICU for a sepsis workup. Had there been a drug screen done on Emily at admission, it would have been positive for hydrocodone.